As the second wave of the COVID-19 pandemic continues to swell, some communities are harder hit than others due to ongoing systemic issues that lead to a higher risk of exposure to COVID-19. In this week's Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinitha Dubey explains what Toronto Public Health is doing to contain the spread of the virus in those areas.
We have been working closely with some of those neighborhoods that have the higher, it's called percent positivity. We look at that number. We also look at the rate of cases that are occurring in those neighborhoods. And we have community outreach workers that have been working with some of those neighborhoods to help address some of that. We want to make sure actually that there's a high enough testing. A 10% positivity rate when not a lot of people are getting tested may not be a true indication of what's going on in that community. But we're certainly working with community groups to increase testing, have access to talk about the public health measures, to see if there are particular needs that need to be met, to even talk about our voluntary isolation center so that people know that if they can't safely self-isolate in their home, there are other options that are available in our city. There is criteria that has to be met to be able to go there. And so when we do our case investigation, if the person who has COVID can't safely isolate from the other people in their household, they could be eligible to go. Or if you have someone who has been identified as a close contact and they can't safely isolate in their home, that they could also be considered if they're eligible to go to the voluntary isolation center.
We've got more from this chat, including technical questions about the tests and vaccines on our websites, citynews.ca and 680news.com. To go directly to the article, you can point your phone camera to the code on the screen you see right now and follow the link that pops up. For City News, I'm Dilshad Burman.